Well, good afternoon or good morning, depending on which time zone we're in right now. But I would like to welcome you to our Strategic Kid Management webinar. This is our second Dairy Goat webinar that Iowa State University Extension and Outreach Dairy Team has been a part of this year, and we are very looking forward to providing more educational webinars in the upcoming years as we take a look at a USDA grant that we have that's been able to help support these webinars and educational programs. So I would like to welcome my colleagues, Fred Hall out in Northwest Iowa, and my colleague Larry Tranel, who's in Northeast Iowa, who will help facilitate today's webinar. My name is Jen Bentley. I also work with Iowa State University Extension and Outreach in Northeast Iowa. And so today's topic, we invited in Dr. Roselle Busch, Assistant Specialist in Cooperative Extension at UC Davis, as she discusses why recommended practices help to control and minimize the spread of disease in your herd. So she's going to cover basics of healthy kids in the first month, going over colostrum management, the use of feeders, and then that role of kid rearing strategies to help mitigate disease transmission. So I did invite people to put in the chat box here this morning where you're from, or if you are in the process of kidding. So you can take a look at that chat box and kind of see where everybody's from and get an idea of when people are going to be starting to kid. It looks like a lot of them are starting or mid-March to April. So we're kind of gearing up. So I think this is a very timely topic. Before we get started with the presentation, just a couple housekeeping things. Just keep your cameras and microphones on mute. We will do questions at the end of the presentation. So just go ahead and put those in the chat box. There should be a chat box button on the bottom of your screen where you can go ahead and type those questions into the chat box. Fred will address those with Rosie at the end. We will record this and it will be archived on our Extension Dairy Team page, and I'll provide that in a link sent to you via email after the webinar here today. As Rosie starts presenting, I will drop the PDF of her presentation into the chat box so you can have that to download, to look at or review as you're going along. And then after the program here today, we will have an evaluation that I'll post in the chat box and then also send out as an email. We would really like and appreciate you to take some time to fill that out. Should take only a couple minutes. That just really helps us drive our educational programs for you as dairy goat producers. And then also, I just wanted to remind you that we do have another Dairy Goat webinar scheduled coming up in June. Again, the same time, noon to 1:15 Central Standard Time. And that we're going to be talking about disbudding and best management practices in disbudding. So Natalie Uri, a small ruminant specialist with USDA, is going to provide some updates that she's discovered through the NOMS goat study. And then Dr. Paul Plummer from Iowa State University is going to be talking about best management practices during that webinar. So I'll also include the registration link for that here at the end of the day. So I'm going to stop share Dr. Busch here, and you can share your screen as I introduce you. Dr. Rosie Busch is the sheep and goat extension veterinarian with UC Cooperative Extension and the UC Davis School of Veterinary Medicine. She received her DVM from UC Davis. She practiced in a rural mixed animal clinic in Hollister, California, before returning to UC Davis to complete a residency in large animal internal medicine, focusing on livestock. She has years of practical experience working in the livestock medicine and surgery service at the Vet Medical Teaching Hospital, teaching students and residents. Dr. Busch then went to work for the California Department of Food and Agriculture with a team of scientists developing evidence-based resources for veterinarians and livestock owners on antimicrobial stewardship. As extension veterinarian, she is currently collaborating on a number of studies looking at practical approaches to improve young stock survival and maternal health and productivity. And so, in one of those, Rosie, you are actually collaborating with Iowa State University Extension and Outreach. And so that's how we got connected here. So welcome to our webinar. And before you take off on your webinar here, I did want to launch one poll if you don't mind.
Yep.
We did also want to just understand who's on our webinar here today. So you'll see on your screen, just asking how you're involved with the dairy goat industry. If you're a dairy goat producer, an employee, a hobbyist, industry, student, veterinarian, nutritionist, educator, or just interested in dairy goats. So we'll give you a little bit to log in here. Looks like we have about 40 people on the call. And I'll go ahead and close that here, and I'll share those results with you so you can see where we're all checking in from. So it looks like the majority of us are dairy goat producers here today, Rosie. So,
Great.
but we have quite a good spread of the industry here. So with that, go ahead.
Okay. All right. Thank you so much. Okay. So I just want to start by kind of, really hitting on the key points. There are a lot of what I'll be talking about are best practices, and there are, many different ways that we can do things. A great example is I live in California. Our climate is very different from what you all are experiencing in the Midwest. So, a lot of my experiences and approaches, do apply to California, but I think there's a lot of crosstalk and applications that can apply even in other climates. Um, so, really brief, the main concepts to consider, and we'll obviously dive into these a bit more, is we really want to provide a clean environment, a warm environment, and keep these guys fed. Nutrition is going to be critical. So I wanted to start with, with that in consideration, we all also have a different tolerance of risk. So, we're not all going to raise our animals exactly the same way. And we all kind of accept, okay, well, if I do this practice, it may have this application um, to my animal's health and their productivity in the future. And you may know Dr. Rao. She's a veterinarian at UC Davis School of Vet Med, and she raises Toggenburgs, and she's incredibly knowledgeable on all things, especially small ruminants. And she tells her clients to think of risk of disease transmission, like buying lottery tickets for the lottery that you don't want to win. So, with every activity or event or management decision you make, how many lottery tickets are you buying? So I think that's a great way to think about this. You don't have to do all of these things, but if you do, depending on what you choose or choose not to practice, you might be purchasing more lottery tickets for that lottery or disease that you don't want to experience. So we'll touch on a lot of these practices are, meant to prevent a lot of these common diseases that we see in newborns. But we will definitely touch on chronic diseases as we go through, because these are the diseases like mycoplasma, CAE virus, Johne's disease, CL, and scrapie that are going to impact their long-term productivity. So they are going to be culled earlier from the herd because of these diseases. They may have impacts like secondary diseases because they have these. So, for example, if they have CL abscesses in their liver, they may not be able to tolerate metabolic challenges at the end of pregnancy. So they may be more prone to pregnancy toxemia. So you might wonder, why are we talking about some of these chronic diseases that we don't see until much later on in life? But there's a lot that we can do right now during this period to try to cut that cycle. But obviously, hypoglycemia and hypothermia are big issues. Navel ill is another one. And then out here on the West Coast, we see a lot of diarrhea and pneumonia issues, probably more so diarrhea for us. And those can be caused by a number of different agents. So we have viral agents like rotavirus and coronavirus. that typically affect goats within the first week of life. We have different bacterial agents like salmonella that can affect them anytime. E. coli typically affects them within their first 5 days. And then Clostridia, which causes enterotoxemia and overeating disease, usually affects them within the first 2 weeks or around weaning a little bit later on. And then we have parasitic diarrheas, which we'll go into a few examples, and then nutritional causes. So thinking about, where can we start to implement some control measures? We kind of want to know, how are these diseases transmitted, or how do they come about? You can see I lumped hypoglycemia and hypothermia together. A lot of times it's kind of the chicken or the egg. So hypoglycemia is their sugars are too low. So they're either starving, they never got up and had their first milk. And so are they not getting up to milk because they're too cold? Are they too cold because they haven't they haven't drank enough or had good enough nutrition? So those two kind of go together, and often they're managed simultaneously. So we have, the importance of quality nutrition, and then also the environment that we're raising them in. For navel ill, it's really about cleanliness of the environment and managing them immediately after birth. And then for diarrhea, we kind of have the whole spectrum. So they can get, have diarrhea from nutritional causes like we have on the list. They can get diarrhea from exposure to different environmental contamination. And then they can have diarrhea from direct exposure. So like these viral pathogens, rotavirus, coronavirus, they can be spread through respiratory secretions between goats as well. It's not really considered the most common way that it's spread, but it is something to consider. And then for pneumonia, again, nutrition is going to be important, or milk. So mycoplasma can be transmitted through milk and cause pneumonia in young kids. The environment. So we'll talk about different ways to kind of mitigate this, but if we have a lot of a really kind of unhygienic environment, that especially with ammonia, which is found in urine, it really damages the lining of the respiratory tract. And that is, can be even at day one, if they're exposed to those gases, it can set them up for pneumonia in that first week of life or even later. And then obviously they can get these pathogens from other goats. And then again, with chronic diseases, they can be transmitted through milk. They can exist within the environment. So like CL, we know can exist on, feeders and different fomites or shovels, buckets, all of those things. And then exposure to other goats that have these diseases. So where to begin? It makes sense to start right at the beginning. Especially with chronic diseases, this is the moment where we can have a really big impact, is by monitoring births. So there's, basically what we really want to avoid is having the kids get up and having them nurse from the dam. And this is most important for CAE control and mycoplasma control. And we are in California seeing a bit of a resurgence of mycoplasma in herds. And so, I think it's a good point to kind of highlight that these are the practices that we can put in place to try to stop that cycle. So there are different ways that, we can try to keep them from nursing from their dam. We can put tape on the teats if we're not able to be there to observe the birth. Oftentimes they're kidding really late at night or early in the morning. So sometimes that's just not possible. There are ways to use videos to monitor. There's, now infant monitors have the video capabilities, and they're becoming a lot less expensive. So that's another option. And then another consideration is to induce parturition. So, you can attempt to time kidding right at a time that would be convenient for you. The way this works is if you know the breeding dates, and it would be best if that breeding was confirmed with ultrasound. There are different protocols for inducing parturition, but basically you would plan to induce, maybe it's around 30 to 36 hours before you'd like to have the kids hit the ground. That said, if she was gonna kid earlier, you can't stop her from doing that. This is just gonna help her. If she was gonna kid on that day or a day later, it'll help her kid right at that time. There's some challenges with inducing parturition in that it may affect their milk production if they're induced too early, and it may also affect the quality of their colostrum. So those are some important things to monitor to make sure that, this is the program that is working for you. I think there's some good things to highlight in this picture. You can see that there's, the bedding is quite wet, and there's a lot of fecal contamination. I mean, especially in a kidding area, it's going to be wet, right? They have birth fluids, and then often when they're pushing, there's going to be feces in the area. But getting the kids out of that environment as soon as possible is ideal. And then you'll notice there's another goat in this image in the back. Ideally, we would have goats that are right about to kid in their own environment, so they're isolated from others. And that, one, it's good for the kids that are born, but two, if she's maybe she's got an in utero infection, maybe there's an abortion agent that isn't causing an abortion, but maybe she's shedding it. That's not something that we want transmitted to other goats as well. So this is an example of a kidding barn where we have one doe who's isolated off in an area. She's the one that we're watching, and these are some of the monitors that you can use. That way you don't have to be in the barn all night. One of the main principles with this kind of maternity or kidding area is to make sure that it's clean. Really important to do between years for sure, but definitely between kiddings would be ideal. So I like highlighting how important that cleaning process is. It's really removing the organic material, all the dirt, debris, getting a detergent in there and sudsing that up, and then rinsing it and allowing it to dry. That's really the bulk of this, hygienic process. Applying a disinfectant is equally as important, but it's going to be, I guess it's not equal. It's 20% of that process is going to be the disinfectant. And depending on what, we're dealing with, pathogens like, let's say, Coxiella, which causes Q fever. We're dealing with pathogens like crypto, which they're really resistant to certain chemicals. So we want to make sure that we're choosing the right chemical for our farm, and that we're following the labeled directions, and letting it sit for the labeled amount of time before we then go ahead and rinse it off or whatever the labeled directions say, and apply new bedding. Okay, so I mentioned two pathogens just there that are zoonotic, meaning that they can cause disease in people, so Coxiella and Crypto. So both of those can be aerosolized when we're cleaning, especially if we're using pressure hoses or pressure washers. So it's important to consider that, we want to protect our health, our family's health, and if we have employees, we'd like to protect their health. And implementing these occupational health strategies can also potentially help with your insurance on the farm, with employees. And so, some personal protective equipment that can be part of that plan would be gloves, protective clothing that can be removed before going to work with pregnant goats or young kids, boots, and then the N95 mask so that we're not inhaling or ingesting anything that's being aerosolized while we're cleaning. Okay, so you've kept a watchful eye on the does while they're preparing to give birth. What do we do next? We put your kids in a box. So starting with immediately after delivery, we'll put them in nursery tubs. And, if you're there at delivery, they can be delivered right into these tubs. And we can keep them clean, we can keep them warm, we can dry them off, make sure that they're breathing and all is going well. In this time is when we would start dipping navels or the umbilicus. So we recommend using dilute chlorhexidine, which is Novosan, it's that blue solution, or you can use dilute povidone iodine, which is betadine, and we like it to look like a weak tea. So nothing too strong. We usually caution about using the tincture of iodine because it does desiccate those umbilical cords. And while that might seem, that's the end goal, is to have the umbilical cords dry off. If that happens too quickly, they can crack and be a good entry point for bacteria. So the caveat with dipping with these weaker solutions is it's really best if they're done multiple times in that first day. So we usually recommend 3 to 4 times. And then we'll put them in a warm location. But really getting them cleaned off, dried off, keeping their navels is really important. The dilution for chlorhexidine, that's how that came up. So it's a 1 to 10 dilution. So 1 part of the Novosan to 10 of a clean water source. Okay, so we have our first poll question.
All right, I'm gonna launch this one here and you should be able to see it. And how soon should colostrum be fed? So you have choices of 2 hours, 12 hours, 24 hours, and 48 hours. I have an idea, Rosie, but I don't want to say until I see all the choices come in, multiple or the options. So and we're going to go ahead and close that, and I'll launch it there for you. So you should be able to see the majority are saying 2 hours and a few in that 12 hours.
Great. So ideally, we would give our colostrum within that first 2 hours. And there's a few reasons for this. One, so colostrum has the antibodies, the immunoglobulins that all animals need to protect themselves from disease, right? Goat kids are not born with this, so they need colostrum in order to get this into their system. It's called passive immunity transfer. Their guts start to close. We know that they're fully closed by 24 hours, but how well they can absorb those antibodies starts to kind of decline with time. So best within the first 2 hours. The other reason for that is because if they are in, even a clean environment, but they're not getting up to nurse well, or they're kind of bumping around in the dirt or the straw or the dust, those organic particles will also cause their gut to start that closure process. So we really want the first thing in their belly to be colostrum. That way they have the best opportunity to absorb all of those IgGs. Again, if we're not able to be there right when that animal's born, within 6 hours is the next best. Within 12 hours would then be the next best. If for whatever reason we're on vacation and the person watching, or I imagine most people don't go on vacation during kidding season, but things happen, life happens. If for whatever reason you can't be with the kids and they don't get colostrum in those first 24 hours, there is a way that they can get passive immunity through, say, I thought I had on the slide, no, but like they can get a plasma transfusion from a veterinarian. So, if it's a valuable animal and they didn't get that colostrum, or you're not sure if they got quality colostrum, a plasma transfusion is another alternative just to have in your mind. All is not lost, but it's really a critical moment. So there are, hour-long, 2-hour-long presentations that can be given on just colostrum alone. So we'll go through just the basics on this one slide. But most importantly, it really needs to come from a clean source. So there's different tiers of quality or how effective colostrum can be. And, kind of the consensus is best choice is goat colostrum that's heat treated. So heat treated means it's held at 135 degrees Fahrenheit for 60 minutes. I've heard from a lot of people that can be really challenging using the kind of old canning method where you keep it in a pot of water on a gosh, what are they called? Like a cooling rack kind of tray, and monitor the temperature. That would be really challenging to keep that temperature at 135 for 60 minutes. There are thermostat controlled canning pots. Some people may have those. There are commercial units that can do these, but kind of a newer technique that has come about in the last few years or last 5 years is using the I'm not French, I cannot pronounce this very well, but I call it the sous vide. Sous vide is, I guess, if you're French, we have a French resident, she would be very ashamed. But so basically what these do is they keep the water bath at a constant temperature. So here's a couple of examples. You can put the colostrum in glass jars and have it in a small bucket with the sous vide. There's another example from Vita Plus. They have designed a cooler where they've even sealed around the sous vide in the cup holder, and they can put multiple either bottles or bags of colostrum in there and heat treat it for an hour in this controlled cooler environment. And then this colostrum that's heat treated can be fed to the kid, but it should only be fed at a temperature of 100 degrees. Anything warmer would not be good for the kid, and then anything cooler can actually affect its ability to be absorbed. So right around 100 degrees would be ideal. Oftentimes we're freezing this extra colostrum, and so they can be frozen in aliquots or in sizes that make sense for your herd. So, we usually recommend in the first feeding giving 10% of body weight. So for a typical 5 to 6 pound kid, that's 8 ounces, which comes out to about 1.5 ounces per pound. So maybe feeding in or storing in these bags at 8 ounces would be a good fit because they'll defrost faster if they're rather than being in these large bags that are 24 ounces plus. And then you can have units for each kid. Another neat trick for defrosting is you can also use the sous vide and set it at 100 degrees and have it so once it's defrosted, it's at that ideal temperature. And let's see, what else am I missing? So then 10% of body weight is kind of minimum. Ideally, you'd be doing 10 to 20% within that first 24 hours. Oh, I wanted to mention these Whirl Pack bags are really useful. You can also use bags that are meant for storing breast milk in freezers. And the nice thing about these is that they store really well in the freezer. Okay, and they can be labeled. They usually have writing strips where you can label them, label that they've been heat treated, label the dough number or numbers of doughs if it's cooled colostrum, and then really important, put the date, because we are not wanting to use these much longer than a year after they've been frozen. Okay, so from there, from the nursery tubs, we're gonna go ahead and put them into these kid condos. This photo's from the goat production handbook. At the UC Davis goat barn for years and years and years, they've been using cardboard boxes. So ideally you'd put 2 to 4 kids in a box, usually they're sibling groups, and they'll stay in these boxes for 10 to 14 days. As for keeping their environment clean, we add straw each day. And if for whatever reason any of the kids in these boxes get sick, you can move the box further away. Because like we said, some of these pathogens can be aerosolized. So you want a 6-foot isolation distance is a good rule, as we're all very familiar with these days. But you can move that box of sick kids further away from the healthy kids. So these boxes are great because they don't need to be disinfected between kidding groups. They're disposed of. So as you all know, you start out with your kidding pretty, you've got this, things are going smooth, and then you hit the peak of kidding time and things can get a little hectic, and really spending the time that you need to clean and dry those containers, but also to disinfect and let the disinfectant sit. It can be hard when we're really strapped for time with a lot of kids coming in. There are different ways to manage that. We can plan when we're breeding to have kidding seasons kind of structured in segments. So you have a few weeks here, take a few week break, a few weeks here. That way you don't go over capacity in your space for the kidding area. So these boxes are typically 3 foot by 3 foot. They can be ordered in bulk from U-Haul. You can get them from appliance stores, from Lazy Boy. I had one person tell me that they save boxes from the kennels that they order for air shipping their kids. So there's a lot of different sources that these boxes can come from. But the neat thing too is that you can write directly on the box who the kids are, which doe they came from, their birth date, all of those important things that go right with how many kids should be in the box. Okay. So, and then obviously we want to keep them warm and dry. So typically we're using heat lamps. There are some pretty sophisticated barns that have heated floors. And then, at the very least, we need to provide a barrier from the wind, because it's really that wind, the wind chill, that takes it off of them. You can imagine these goats have a lot of surface area to volume. So compared to an adult, they have a lot more skin to core temperature. So they get cool really quick, especially in the wind. And then we want to make sure that they have dry bedding. And a good way to test that is just kneel down there. And if your knee gets wet when you kneel down, then it's too wet for them. And while you're down there, take a big wafty breath. And if you cough because it's dusty or there's too much ammonia, that tells you that maybe we need to think about the ventilation in these areas as well. Because remember, they're a lot smaller, so they're down in all of that, where we might not realize it if we're standing up. A note about heat lamps is that you want to make sure that the lamp and the cord are not within the reach of kids. Most barn fires are actually started by faulty electrical systems. So when using heat lamps, try not to use too many extension cords, and don't go over capacity for our electrical outlets. So don't use a lot of those splitters or surge protectors. Try to have 1 or 2 per outlet if possible. All right. Then we get into kid groups. So usually we're merging them into bigger groups at around 2 weeks of age, usually in groups of about 10 kids, and we're grouping them by birth date. So ideally by birth date. We'll go into a few examples for why this is important. And then they can be, if we have a lot of kids, we can group them by size. I have an example of a situation where a young kid was put in with a group of older kids, and you can see how much smaller she is. And so she's having to compete for feed, and she's having a hard time here. So this would be a situation where she should be pulled out of this group and raised either with a kid her size or potentially on her own, or with one bigger kid that's less, it's not going to beat her up as much. Okay, and another reason to group them by age is because of disease transmission. So I always like to talk about the disease triad before we kind of get into these examples. So an animal that gets sick, there's a lot of different factors that go into why this animal is showing signs of disease. We can do all that we can to really clean the environment, keep up after them, but it's kind of unreasonable to expect them to not have any exposure to any parasite or any bacteria, right? So they're going to have that exposure, and that's normal. What helps them deal with that infection is their host immune response. So they have, they've had good colostrum, they have adequate nutrition that, gives them the best immune status that they can have. And in some cases, we've vaccinated the doe prior to her kidding time. And depending on the disease we're dealing with, like Clostridium, so if we have enterotoxemia in those first 2 weeks, or if we have E. coli, there are some potential options for extra label vaccine use for actually vaccinating the doe. And then when she is developing her colostrum, those antibodies will be a source to protect the newborn kids. So that, the host status is important. And then, how much contamination there is in the environment. So whether that's fecal contamination, so how able are we to keep up with cleaning up pens, or in the instance of pneumonia, potentially it's stocking density. So how much how close are we with the respiratory? How good is our ventilation? A lot of these things are concerns with how much of that pathogen is in the environment. So what is their infectious dose? you know um, so all of those things kind of work together and kind of play into what we see as far as sick kids. Okay, so I have another poll question. This is stretching our knowledge here. It's kind of trivia. I wouldn't expect everyone to know this, but it's kind of I wouldn't say fun fact, but
Yeah, so I just launched the poll. What is the smallest amount of Cryptosporidium parvum oocytes necessary to cause diarrhea in a goat kid? And I don't know the answer to that either. So I'm seeing the answers come in, and we'll see where we're at. That's a good trivia
it's for your
question.
next cocktail party when you get to have those again.
Yeah, we'll have a virtual one. All right. Give you a few more seconds to think about it here. This one's taking a little bit longer for people to think about, so we'll give them a few seconds. And we'll go ahead and share those. So I'm curious. Looks like we're kind of all over here. So you
Yeah,
said you
so we
do you
have
see adults? Okay.
half of the group says 10. About a third of the group says 500, and then we have a few with 1,000 and a few with 100,000. So it takes as few as 10 oocysts to cause infection in a goat. And in really naive goat kids, so if they had failure of passive transfer, you can have really severe infection with as few as 10 oocysts. An oocyst is basically like the egg that is coming from the parasite. Okay, so we're gonna run through a scenario. Bear with me, I did practice this, I promise, but this is a little tricky. So crypto, whoop, I have a little thing on my mouse, so it's scrolling. Okay, so let's say we are starting, kidding season, and this is our mama goat, and this is day 1. And she has her beautiful little kid, and whether it came from, let's say, whether it came from the doe or the environment, let's say this kid was exposed to 10 oocysts. Now, about a quarter of healthy animals without symptoms can shed crypto. More likely, it's coming from the environment. So Cryptosporidium oocysts can survive in the environment for years. They're incredibly difficult to get rid of. They're resistant to chlorine disinfectants, so that would be like bleach. The best disinfectant to use for them is hydrogen peroxide type of disinfectant. Okay, so 10 oocysts this goat kid has been exposed to in as short as 10 days. But let's say this goat got some colostrum. We'll say in 14 days, she can shed up to, oh, what happens in 14 days? So this was the first kidding. What happens in 14 days usually? That's 2 weeks. Typically, depending on how we've got things set up, that's the peak of our kidding. So in 14 days, we've got a healthy 2-week-old goat kid, and we're busy, we're jamming, but she has some soft manure. And in this manure, she's shedding hundreds of thousands of oocysts. Now remember, it only took her 10 oocysts to start shedding that many because they just reproduce so much in the gut. She might not be really sick at this moment. You might not even notice it, except for her feces are softer than normal milk feces. The challenge with this is that these cryptoocysts can infect goats immediately. So she can be reinfected. Other parasites usually have to, it's called sporulate, so they have to kind of develop in the environment for a number of days. Like coccidia, it takes about 7 days in the environment before that egg that's in the environment can infect another animal. So it gives you a bit of wiggle room, right, to clean up between these shedding cycles. But with crypto, you don't get that wiggle room. So she can expose, if we're housing with different age groups, another newborn goat. And just imagine with a very young goat exposed to that level of oocysts in 10 days, we've got, okay, in 10 days, what kind of level we're shedding. So we've got millions of oocysts just in 10 days. And if we're lucky, our original goat is still with us, but in a lot of cases with this type of reinfection, they don't make it. So what's the difference between these two cases? Remember what we talked about with infectious dose and then immune status. So our original kid that may have been exposed to a small number of oocysts could have potentially managed this infection if our environment was kept clean and they weren't reinfected. And then they develop an immunity, right? This is why we don't see a lot of symptoms in adult goats, because they have an immunity to, if they have good nutritional status and they're not dealing with other secondary infections, they can sustain immunity to these parasites. Um, and young goats will get there. They can, if their environment is kept clean and they're not burdened with huge infectious doses, they can get to where they have immunity. But if their first exposure to this parasite is, hundreds of thousands of oocysts or millions of oocysts, we kind of it turns into a vicious cycle. And there really isn't there is no legal treatment for this. So it's really something that we have to consider with management. And so this is, specific example for crypto because it is such a challenge when it does affect our kidding seasons. But it could apply for other, other parasites. If we have heavy burdens of nematode parasites or coccidia in the environment, these young kids they don't have the immune system to really deal with those infections. So we really do have to manage that with the environment. Part of that is, what are we dealing with? So we talked about disinfection. So in this environment with, wet, muddy ground, it's going to be really challenging to disinfect these pens. Potentially we have bedding that can be removed. And so it's, less fecal contamination in the soil. But, we do like seeing the pens that keep them out of the wind. And they have lots of space. So, all right, another option is having them in a barn, an open space on cement. So these pens can be moved. The cement ground that was, let's say each new kidding group the pens are going to be set up in a different area in front or behind them. And the cement ground can be scraped, it can be disinfected before those pens are put on. The challenge with these wire pens is that a lot of their bedding can get pushed out. And ideally, we'd be feeding hay off the ground so that they're not contaminating their hay with manure. But there are different systems that you can design. There's some wood boxes, potentially cardboard or a netting that's finer can be wrapped around the bottom to keep the bedding in. But they're in a controlled barn environment, so temperature is probably not as much of an issue in this situation. And then we have some creative ways of getting them up off of, if it ever rains in California, out of the mud. So these, it's pretty typical to see kid piles. And so this is kind of a creative way to get them up out of the dirt, out of the mud on these pallets. Okay, so we'll do a bit on some feeding practices. It's also really important for managing diarrhea. There's a number of different systems that are used. So there's either mob feeding or meal feeding. So that's where you're feeding them multiple meals throughout the day. Usually it's 2 to 3 times a day. That can either be by bottle or as you see here in the buckets. This milk in older kids can be poured directly into the bucket. this system, if you look closely, you can see there's cups at the bottom of the bucket, and each straw is going into each cup. And so for really young kids, it's a great way to see if that kid is effectively using that system. So are they actually nursing? Are they kind of just playing with the nipple? How much are they eating? So, not eating a full meal might be your first sign that something's not right with that kid. So these systems, might be helpful because they take a bit of labor because you do have to feed them multiple times a day. The more often, usually the better, because if we're only feeding them 2 meals a day, they can be at risk of getting bloat. So if they eat too much at one time, they can get bloat or enterotoxemia. So if that milk isn't emptying their stomach fast enough, it is basically great medium for Clostridium to overgrow. So that's when we typically see those. So, more meals throughout the day would be better for those. Another type of system are these free choice cold milk systems. So that's what you see on the lower left. It's a cooler with the nipples through the holes that have been drilled out the side. And then those are ice packs that are in there. And the cold milk kind of keeps them from gorging too much. Temperature really does a lot to regulate their intake. And in this system with cold milk, it doesn't spoil as quickly, right? So it can be left throughout the day, and goats have free access to smaller meals throughout the day. The challenge with this is that you really have to monitor the kids closely and make sure that they're using this system. So it might be something that there's in the goat handbook, there's pictures of cups in the cooler. It might be challenging because you're not there watching them, right? So it might be, you don't know which kid is drinking a lot, or so it's really, you have to be hands-on and get in there and make sure that they have full bellies, even though you have this automated feeder that's meant to take a lot of the labor away. They still need quite a bit of monitoring, especially when they're just kind of getting into this, learning how to use the system. And then there are these automated feeders. Oh, I wanted to mention another thing with the cooler system. They don't work very well for milk replacers because milk replacers tend to settle out of solution. So you would need an agitator or something in there to keep it in solution, which is, can be a bit challenging. The automated feeders basically mix milk replacer and warm water in small batches. So they're less likely to spoil, and the water temperature is adjustable. So, if you don't want to feed it too warm, basically it is something that probably has to be played with your system and your climate. But milk that's really warm and inviting, kids might gorge themselves on. So it might be something that you want to dial back a little bit with these automated feeders. And one note with them is that you want to use a milk replacer, again, that's going to mix well and stay in solution. So you don't want them separating out. And then when we're talking about preventing diarrhea, so the temperature and frequency are really important. So temperature of the milk and how often we're feeding. We definitely want to feed in CAE and mycoplasma control programs. We want to feed pasteurized milk or a milk replacer. There's another option for acidified milk. If pasteurizing that is, we are not set up to do that with acidified milk. There's basically you're adding 3 mils of dilute formic acid to 1 liter of milk or even milk replacer. Some of the benefits of that is that they're less likely to gorge themselves with acidified milk. So they're going to take more frequent, smaller meals throughout the day. and it doesn't spoil as quickly. You want to make sure that if we're using milk replacer in these different, even in the mob feeding systems, that we're really being precise and accurate with how we're mixing these up. And another option is whole cow's milk, which is definitely, it's a pretty reasonable source. There are a few studies that show that whole cow's milk might actually be better than milk replacer. A lot of these studies are, within the last 10 years. So milk replacer has really developed in the last few years. So it's hard to take those studies and really apply it to today, because our milk replacers, before, they didn't have enough protein, they didn't have enough fat, they were using soy-based protein. So when selecting a milk replacer, you want to make sure that it's a whey protein. Look at the components, talk with your veterinarian or your nutritionist about what would be right for you. But whole cow's milk is definitely an option. It would be ideal to pasteurize that, because Johne's disease can be transmitted between species. So there's, best to feed pasteurized whole cow's milk if that's what you have access to. All right. Let's get into the next poll question.
Okay, so our last poll question here, I'll launch that for you, is how often do you replace nipples and tubing? So do you replace it once a year, once a month? Maybe you don't use that type of system, or never. And are you kind of talking the manual type of feedings versus the automated?
Even with the automated,
tubing in general?
Tubing and nipples in general.
Yeah. I know that was one of the biggest things, at least for dairy calf side, when they moved to automatic calf feeders, was just that learning process of all that tubing and equipment that, we have to be cleaning on a regular basis.
Yeah.
So it's pretty important. Yeah. I'll end the poll here, and here are your results.
Okay, so about half people say once a year. A third are at once a month, and then the rest don't use this type of system. So that's great. Okay. So a bit so ideally we're replacing these every month, especially with tube feeders that are going directly into the stomach. So tube feeder, when we're having to tube feed colostrum or tube feed electrolytes for sick goats, those should be replaced very often. The nipples and tubing lines for these, either the cooler systems, even the mob feeders, all of these the automated feeding systems, they have to be cleaned every single day, cleaned and disinfected. Good to have a bleach solution run through them every single day. And why are we replacing them is because biofilm is a huge issue with milk products. It's an issue with processing. It's probably where you see a lot of the literature is on the processing side. But basically milk, that fluid milk, is it's called a conditioning layer. So let's look at this image that I borrowed from a paper on biofilms. This base layer here would be the conditioning layer. So it's also the type of material that the tubing and the nipples are made out of. They're really great for biofilm formation, but then you add milk on top of that, and it's just the perfect environment. And there's in different studies showing that layer and bacterial adhesion to that layer starts within seconds after milk has contacted that material. So what you have is you have bacteria adhere to this layer, and then they form a matrix that kind of shelters them from any kind of disinfectant. It shelters them from heat. And then even these bacteria are even more likely to become antibiotic resistant. They have some, mutations that happen while they're in this biofilm. It's pretty wild. And then once the biofilm grows to a certain time, you get this huge release of bacteria. Typically, these are staph and Pseudomonas, excuse me, staph and Pseudomonas that cause these biofilms. But they can certainly cause GI upset and really alter that good intestinal flora that you want your kids to have and make them sick. So definitely something that we want to control. There's a question about putting the equipment through that same acid wash as the milking equipment. Unfortunately, biofilms tend to be resistant to those as well. So it's, I think that's why we replace our cups in our milking equipment. Like there's reasons why we're replacing these things on a regular basis is because these can be really, really challenging to deal with. So just a thought when we're, hanging on to these nipples year after year, which fortunately look like no one in this pool is doing that. But, they should be replaced on a regular basis. Okay, and then just a little tiny little bit on once they've been weaned, ensuring that they have, adequate bunk space and just how important nutritional support is for long-term productivity of these animals. Then when we're getting, we're talking about long-term productivity, we're talking about disease control. We're implementing a lot of these practices because we want to have good quality replacements that are not going to have the same issues that maybe our current animals are having, that we're seeing now as they're getting older into life. Really important to have permanent ID and records. So, we're going to have permanent ID of that dam. As soon as the kids are born, there's different ways to have temporary IDs. Some people are painting onto the kids with, safe paint, or there's paper collars that can be used, or there's wristbands that can be taken off, where you can put the dam's number, the date of birth, and then what their ID, their registration or tattoo number is going to be. It's good to have those on, but really they can outgrow them quickly, they can fall off, they'll lose them. So it's good to get that permanent ID on that kid pretty soon. So it's recommended that we tattoo our kids, not that kid, sorry, within about a week or around the time that we're disbudding. So it's a great time to do both of those processing things. I have a note about measuring colostrum IgG. So if we are having issues, this is going to be farm dependent. Not everyone needs to do measuring colostrum IgG. It could be important to measure goat kid IgG if we're having some issues. And, especially with colostrum quality, there's different management factors that can go into the quality of that colostrum. And if we don't know where we're at, we don't know what our baseline is, or we don't even know to fix these things. So this is where measuring and keeping good records can really help us with that side. And then, we're starting to implement these practices that can really impact chronic diseases and productivity later on. Really important that we continue to do routine disease surveillance. So whether that's doing blood tests as they get older, milk cultures as they come into milk, and then necropsies of anything that's suspicious. So I think are we about out of time here? I had
Yeah, we can
more.
take, go ahead. We can finish it up and then we'll take questions.
Okay, cool. I did this pretty quick. So it's an example. It is basically how long it would take to go from a chronic diseased herd to a clean herd through this kind of replacement system. It's based off of a 20% cull rate of a diseased herd. So, let's say we have all the diseases, or even if we just had mycoplasma, you could have that about that high of a cull rate, and then based it off of 100 milking does. So basically looking at how long it might take to go from 100 in your chronic disease, uh, and then go to a completely clean herd just through this replacement system. Again, this is not taking into account culls on the clean side. Um, but if we just implemented these practices and segregated these animals throughout their life, so now you have a clean side and a dirty side, it could take a while, right? After you get to about 10 years, you're just culling one animal or two animals. And when I think about that, I'm like, I still have these, these are my infection sources. I would have one or two animals that could potentially be a source of infection to my clean side. And realistically, we're not managing those animals separately when you get to that level. So, if we can start implementing these practices after about 3 years, you've got a fair number of clean replacements that are in production. Potentially they're outproducing this diseased herd. At that point, maybe you work with your veterinarian on doing a test and cull program, and then you can get more clean replacements back in. So, we talk a lot about, it seems like a lot of labor to implement these programs to really set your kids up for a successful future. But then when you think about the reward and establishing a clean herd, having a reliable source of replacements, it, we can start realizing this a lot sooner than we think. So a really good resource to have on hand is the Dairy Goat Production Handbook out of Langston University. That has to be ordered with an order form. And that link is in the chat for you. And then I think we can take questions.
Okay, Dr. Busch, we've got a bunch of really good questions here. We're going to start with one of the earlier questions. You talked about sanitation. Can you use protein swabs to monitor cleanliness in dairy goat feeding equipment?
I'm going to show my ignorance. I don't know. I mean, if it's used in another dairy system, I would imagine, but that is not my area of expertise, unfortunately.
Okay, we had a question early. You'd mentioned chlorhexidine. And what is the recommended dilution for chlorhexidine?
Yeah, so that is a 1 to 10 dilution. So it's a pretty light blue that you would see.
Okay. You'd mentioned putting tape on teats to keep kids from nursing. Why would you want to prevent nursing right after birth by putting tape on the teats?
Yeah, so that's a good question. This is because if we're doing a CAE or mycoplasma control program, those diseases are transmitted through the dam's colostrum and milk. So we're wanting to prevent them from nursing from the dam so that we can collect that colostrum, and we're completely separating the kids at that point. We're heat treating the colostrum, and then, for whatever, if we're still using her milk for the kids, we'll be pasteurizing that. Otherwise, we're looking at other sources of milk for the kids. But yeah, that's more for specific disease control programs.
Okay. You'd mentioned in one of your later slides to measure the IgG in colostrum. How do you do that?
Measure IgG in colostrum. That's a good question. So there's units, they're called colostrometers. They're basically a hydrometer. So those can be used. The ones that are out there for dairy products they're marked with like good, like green, meaning this is a good number of IgG, and then red, meaning it doesn't have enough IgG. Those are based on cow measurements, so they'd be a little bit off, but pretty close. There are other ways to measure with refractometers. There's Some people are using digital bricks recorders, like you would out in California on a vineyard, they would test their grapes for bricks. And then even color. So goat milk isn't the same as cow milk in that it doesn't have keratin in it. So it's not typically kind of that yellowish color. So that means that the yellow color that we're seeing in colostrum is coming from those proteins that are in specific to colostrum. So there's a study done that looked at the different kind of color gradient of colostrum and showed that if you had a fan card, almost like famacha, if you had a fan card of those colors, you might be able to tell based on color how good that colostrum is.
Okay. You'd mentioned colostrum replacers and milk replacers. What fat and protein percentages are you recommending for first the colostrum replacer and then the milk replacers?
You know, I don't have those off the top of my head. There are some really good resources out there. I believe they're also in the Dairy Goat Production Handbook. But that I would talk with your veterinarian and your nutritionist about. Sorry, I don't have that right off the top of my head, so I don't want to make it up.
Okay, very good. Is Lambo mob feeding warm milk better than cold ad lib for growth and gut health of kids?
For gut health. I think there's pros and cons to both. So the lambar mob feeding, if we're feeding, you know, twice a day and they're getting really big meals, that might be a challenge for their gut health because it's, you know, it's an opportunity for Clostridium to grow. That said, there are some systems that do that very well and it works for them. The cooler system where they have access to the coolers throughout the day, that can be a challenge because you don't know which kids are getting to it. It takes a lot of observation of the kids and their health and how full their bellies are. So I think, you know, but again, some systems do that really well. So the typical cooperative extension answer is it depends. I think, there are all of these different feeding systems that work. It's really important when you decide which one to use to know what to look out for your animals, just so that you don't start seeing those complications.
Okay, this is kind of a mechanical question. You showed the cardboard boxes for newborn kids. How does a person practically get into the boxes and fork them out and keep them clean?
Yeah, so you're not. So those boxes, they're really just adding hay on top throughout that 10-day period to keep the top layer clean. So the kids are really small. They're not going to be touching the bottom of the box. So in those systems, they're meant to be disposed of once those kids are out of them. If we're I think that one picture, I think it was recent. I'll flip back to that and see if you can see how much hay is in there. But you can see in this picture, there's quite a bit there's like 2 feet of hay in here, or straw, sorry. That, so there's, you're able to kind of stack that up on top. So you're not getting in there and really cleaning it out. And then again, once that box goes away, once the kids are out of it.
Very good. Can you give us a quick review of what we should do with the umbilical cord at birth?
Yeah. So ideally they break a few inches from the belly. So, 3 or 4 inches or so. If they're really long and they're dragging on the ground, that might be something that you'd want to break a little bit higher, being really careful to not break them too close to the belly. And then, if for those that are cutting them, that's when I saw a comment about tying umbilical cords. If you're cutting umbilical cords, you might want to tie them so that you don't get some fluid loss or the nice thing about breaking them is it stretches those the contents of the umbilical cord, and then when it breaks they kind of collapse. When we cut them, they don't collapse as well, so tying those if we're cutting them might be good. And then you can take a clean cup and with your just dilute betadine or Novosan, and we just push them up to the belly and swoosh them around, and then discarding that solution, so it would be a new solution, so it's clean for each one. Another option is spraying the umbilicus, so that you're not having to deal with the cups, just making sure that you get a good saturation on the cord with the sprays.
Very good. I've actually got two more questions. Jen, give me a thumbs up if we got time to go ahead and, all right. For CAE prevention protocol, when pulling babies from dams, do we clean them in a certain way or just dry them off?
Yeah, just drying them should be sufficient. As far as other pathogens that you might be concerned about that would be on these kids at birth would be like Coxiella. So even healthy kids and healthy dams can shed Coxiella. So that would be something where you would want to make sure that you're wearing gloves while you're cleaning them, and potentially an N95 mask during that time, and just towel drying them. Anything that's really aggressive, like a blow dryer or something like that, could aerosolize those. So, just getting them towel clean, making sure they're in a warm environment would be good.
Okay. Final question. You'd referenced testing the herd. Do I need to test every single goat on my property annually? Can I skip goats that are not used for breeding? And who needs to be tested for what and how often? Is this one time a year better than another?
So those are really great questions. Again, it really depends on what your goals are. So, if you're breeding for replacements for your herd and to sell to other herds, ideally you're testing those, the bred animals. So the animal, and annually is a great place to start. As you start seeing the disease control program take effect, depending on how closed your herd is, you could do that at a different frequency. So maybe every other year or so. But if you're going to shows or you're bringing in new animals, take that into consideration when you're talking about testing. So it's really about knowing which animals that you're monitoring and segregating. And that might look a little bit different for each herd.
Well, thank you very much. We had some great questions here. I felt like I was proctoring a PhD test or something. We had good ones. With that, I'll turn it back over to Jennifer.
Yeah, thanks, Dr. Busch, for answering those questions. Great webinar here today, talking about kid management. I think we noticed in the comments there, people are starting to kids. So, taking these management practices and, trying some of them out and implementing them and hopefully having some healthy kids here in the next couple of months. So just a reminder, I did put the evaluation link into the chat box. So if you get a chance, if you could click on that and fill out the evaluation, for us today, as well as I did put the registration link in here for the next upcoming webinar that we're going to have on June 2nd. So a couple months away yet, but if you can just get your registration in, that way you can get an email reminder when that comes up in June. So appreciate everyone being on here today. And again, thanks, Dr. Busch, for being on. Have a good day.
Yeah, thank you. Take care.